Good morning. How are you doing today?
I'm good. How are you?
I'm doing good. How's baby doing?
No complaints.
Are you super excited to go home?
Yes, very tired of being in the hospital.
Oh, I can imagine, for sure. I'm just going to go over your discharge sheeting and hopefully get you out of here as soon as we can.
Great.
So since you just had a C-section, I just wanted to go over some things that you'll need to continue at home. So we're going to keep the incision dry and clean. Don't touch it a bunch. That could kind of cause some infection. You're going to wash it with warm water and a mild soap. And then be sure to pat it dry gently just to keep it dry. Don't wear really tight clothes or cotton underwear to keep it dry and prevent irritation. You can take over-the-counter pain medications as needed for kind of breakthrough pain, or if you're just having a little tenderness. You just had a major abdominal surgery, so let's just take it easy, okay? No heavy lifting. Don't go run a marathon tomorrow. You'll need to follow up with your doctor for sure when you can be cleared for extended activity. While we're talking about the incision, I'm just going to give you some signs and symptoms of infection to look for. So any redness or swelling, tenderness, or pain that wasn't there before are definitely signs of infection. And then discharge, such as yellowish or greenish or even white kind of coming out of there that's more than normal. Definitely be sure to tell your doctor about that. That way you can get on some antibiotics and just get that cleared up pretty easily. And then, so even though you just had a C-section, you definitely have some vaginal bleeding going on. I'm sure you're well aware of that.
Yes, I noticed it after delivery.
I'll just give you a basic rundown of how it'll progress kind of after you leave the hospital. So you're on day 2 right now.
Yes.
So for a couple of extra days, it'll be kind of the darker red that you're seeing now. And then days 4 to 10-ish, all of these are pretty rough numbers. They're different for everybody. But on day 4 to 10-ish to 2 weeks, it'll be a pinkish brown, kind of lightening as it goes. And then after about 2 weeks, up to 8 weeks even, it'll be a white, yellowish white, as your body just kind of continues clearing out all of the stuff that was in there. It should never go backwards. If it's getting lighter, it should never get heavier and or change colors back to what it was. So if you're in the pinkish brown stage, it should never get to be a darker red. So some signs and symptoms that are going to require immediate medical attention. I have this whole paper about it.
Okay.
So kind of on there, it explains that if you have extreme persistent pain at the incision site or kind of in your pelvic area, you definitely need to get that looked at. You could have some wound complications, like tearing your incision or something if you kind of overdid it. So preeclampsia, I don't know if you've ever heard of it, we didn't have it, but it can develop up to 6 weeks after you have the baby. So signs of this, it's very high blood pressure really. So signs of this are severe headache, vision changes, feeling fatigue, that kind of thing. And it definitely needs to get reported because it can develop into eclampsia and you can have seizures then. So another complication after pregnancy could be a deep vein thrombosis. So you'll just have blood clots kind of in your legs that could eventually travel to other areas. We don't want them, heart rate, lungs, that kind of thing. So signs of that would be unilateral swelling just on one leg, heat or redness in one area on the leg. Be sure to seek immediate medical attention. That way it doesn't go anywhere. And then if you're having a new onset of feelings of depression, wanting to hurt yourself with a baby or something like that, you definitely need to get that seen as well. So since you are going to be breastfeeding, I'm just going to go over some breast care that you can continue at home.
Okay.
So we're just going to wash them with water, no soap, because it can be kind of drying. Use the lanolin cream we gave you, and don't use any lotions that can block the oil glands in the actual nipple, and baby doesn't really need to be eating lotion. And then make sure you're using the proper technique to avoid damage to the nipples themselves, the latch technique, and then use comfort measures as needed, heat and cold, and that kind of anything that will help them feel better if they're a little bit tender, especially when your milk starts coming in and they're a little bit engorged. So when breastfeeding baby, make sure they're latching correctly. Their chin needs to touch the breast, and they need to be mostly aligned during the whole feeding, like the ear, shoulder, and hip need to be all in a row. And then if they're swallowing, they're eating. If they're having frequent wet diapers and gaining weight, they're eating enough. So don't stress too much about that. The most important thing to know is to relax with that. And then, so with the umbilical cord care, we are going to leave it alone because it can get infected. If there's a little bit of blood or like gunky stuff, you can use an alcohol wipe just to get it off. Signs of infection are the same for baby as they are for you: redness, swelling, if they look like they're hurting the baby, or if there's any discharge coming out of it, that definitely needs to be notified to the doctor. And then let it fall off naturally. Don't pull it off, or it could cause extra bleeding or chances of infection because it's an open wound then. And then, so after that, we're gonna avoid getting it wet, like submerging it in water. So we're gonna do sponge baths only, and until it falls off. So, and you can do it about 2 to 3 times a week. Babies don't get as nasty as adults, so they don't really need a whole lot of baths. Plus, it'll avoid drying their skin too much. Keep them from getting cold, so do warm water and like a towel covering them to make sure they don't get too cold. And then once the umbilical cord falls off, you can give them a normal tub bath. Just make sure that don't leave them unattended, or just watch them the whole time. So, and then safe sleep. Once you get baby home, they do a lot of sleeping. So we're gonna leave nothing in the crib. Use a firm mattress with like a tight fitting sheet. That way it can't get wrapped around baby and lead to SIDS or something like that. And then swaddle only if that's what we're using. Use like tight fitting jammies that aren't gonna get all up in their face. You can only swaddle until they show signs of rolling over, because then they wouldn't be able to get back up if they rolled over with the swaddle on. The burritos can't roll back over. So, and then since you're going home today, we're gonna do some car seat safety. Infants like this do have to be rear facing in a car seat that's compliant with federal regulations, which most of them in the stores are. They'll say approved or whatever by, I don't know, the car seat people. No bulky clothes. Since we're coming up in the winter, don't put huge jackets on them and then buckle them into their car seat, because it's not going to get tight enough on their chest. And the buckle needs to be about level with their armpits, just to make sure it's not too low or too high. And you can fit 2 fingers underneath the buckle comfortably, and that should be good. And then the straps need to be at or below shoulder level, to keep from getting kind of like up here. It just makes the safest like restraint system. So a lot of fire departments also, if you don't know how to do it, can show you how to install the car seat in your car. The base needs to be level with the ground to promote like the right angle, so your baby doesn't fall forward and then they can't breathe. So they'll let you know how to like restrain it properly, put it on like the anchors, especially in like new cars, they have anchors. And so that should be good. Okay, so do you have any questions about going home with baby or yourself, really?
No, everybody here has been so helpful. I feel like I've learned a lot from my first child.
Awesome, good. So here's a pamphlet about breastfeeding. It's got a number for a lactation consultant if you feel like you're having problems or baby's having problems latching or anything like that. You've been doing good, so I don't foresee any problems, but just in case, the number's on there. And then it's got some breast care tips. So if you don't have any questions, we'll get you ready to go home.
Yay, I'm excited.
Awesome.
Thank you so much.
You're welcome.